I'm Caroline Nogas. I'm 14 years old. I was born with a congenital short left leg. For the past 9 years, I've been a patient at Shriners Hospital. This is my story.
Caroline was my third pregnancy. I had 2 previous pregnancies that were normal. I found out about Caroline's condition during an ultrasound. So she was in utero, probably about midway through the pregnancy. And what I was told was that there was a short femur. A week after her birth, we saw the first orthopedic surgeon in our area. We saw that surgeon for a while, and we just didn't feel comfortable. We felt like maybe we weren't doing everything.
We're so warmly welcomed at the Shriners outreach clinic in our area. We knew that we should pursue that avenue. And we saw the facility, we saw the comprehensive care that could take place on campus. To hear the stories from the staff about how they really did care about the overall experience that a child would receive here, we felt that we were on the right path. And when we met Dr. Gates, we knew this is where we needed to be.
So when someone who's very young comes in with as much deformity as what she had, as much shortness of her leg as what she has, then a very definite consideration is to do an amputation and just let a kid get on with their life. All right, well, I just want to check a couple of things. She would require a minimum of 3 surgeries. Each of those take about a year of your life to do the gradual lengthening of the bone, all that's involved with that, regular x-rays, pin care, pain, all of that sort of thing. So that takes a lot of your life as a child. So family has to weigh that against getting an amputation, having a prosthesis, and getting on with their life.
Her first lengthening was at age 7. We lengthened her tibia. And 3 years later, we lengthened her femur. 3 years after that, we lengthened her femur again. So she's had 3 lengthenings where she has gained probably 7 inches.
Some things were kind of hard because I couldn't do a lot of the things that other people were doing. And I missed a lot of school, and so there were a lot of times when I didn't see my friends or my teachers.
So anything Caroline has had any desire to participate in, we have supported that, encouraged that, but always ran it by Dr. Gates.
She still has some challenges. She may have some limitations. With the spirit that she has, I don't see her giving into those challenges very much.
I think it's so cool that Caroline does not feel like she has any limits. Maybe the atmosphere here at the hospital has given her some added confidence.
I'm just going to get a little bit of history so that...
They talk about family-centered care as some goal or something, but I've been here 20 years. That's exactly what we do. We are all family together.
While her birth defect doesn't define her, I think it certainly has shaped who she is now and who she'll likely become in the future. And just a quick story, this last surgery, the surgery procedure before last was particularly challenging. And if she would have said, I don't want to do it, I would not have pushed the matter. So when it was time to plan for the surgery, we started talking about it, and I even mentioned to her, so are you sure? Maybe hoping some way that she said, I don't want to do it. I said, you sure you want to do it? And she looked at me and said, I've come this far, I have to finish.
I've learned to be grateful for all of the things that I can do, because when you can't do something that you really love for a long time, you realize how nice it is to be able to do it.
And for my husband and I, to see her have such quality in the things that she does, you know, she's enjoying life.